With so much happening around the world and truth being revealed every day, I think this time of the year, it really hits home with a lot of people. Many people remember the 2020 protocols of what happened in closing down our society, not educating our children, removing the advocate from the bedside, telling people to stay home unless they turn blue in the face, and then to be met with an experimental test to test for said disease, and then be given the experimental EUA. When I say experimental, guys, I mean the emergency use authorized swabs, the emergency use authorized remdesivir, the protocols that just suddenly changed overnight and we stopped following science, removing the advocate from the bedside. I mean, we can go on and on down each individual rabbit hole, and many people would still be shocked. Well, I did a post this week when Chris Cuomo decided to come out and say that he was being treated with ivermectin and that he was given bad information that he spewed all over mainstream media for years. And now it's like he just wants us to be over it and move on from it. And now he's on the right side with really no apology at all. You know, nurses, physician's assistants, doctors, we're all bound to certain ethical principles and autonomy and treating the person holistically and providing true informed consent is imperative to our profession. And that's why, you know, nurses for decades had been deemed the most trusted profession in America. And that since has all changed. But there are people that have been out there fighting on the front lines that you don't hear about. People that are still fighting for their licenses and their livelihood. And Sarah, she reached out to me on Instagram. She made a comment about what she had done. Was Sarah is a master's prepared physician assistant, and she worked at Dignity Health Urgent Care in California when the COVID mandates were first enforced. She quickly learned that the COVID treatment protocol being used in hospitals was a death sentence, and instead successfully treated thousands of COVID patients with ivermectin. Now, Sarah ultimately left the urgent care and treated patients on her own using a combination of therapeutics, including oxygen, ivermectin, hydroxychloroquine, budesonide, and a variety of vitamins. She also pulled patients out of the hospital to care for them at home when so many were trapped there and didn't know what to do. She also refused to take the experimental shot or to participate in the mass vaccination protocol, seeing firsthand the side effects from the vaccine. She currently owns a practice in Nipomo, California, where she treats a variety of patients, including those who are vaccine injured. I had a brief phone call with Sarah before I decided to invite her on to the show to tell her story. And let me tell you guys, what you are going to hear today is going to just blow your mind. Even for me, that have heard thousands of stories, talked to thousands of you, I still was just in awe at her courage and her strength that really preemptively made her the physician's assistant, the provider that she has become. So we are going to get into all of that and more today here on Nurses Out Loud. I am your host, Nurse Jody O'Malley, and you can find us here 5 days a week, Monday through Friday, with a different nurse host daily. And on Fridays, we've been getting together to answer your questions and to talk about the emails and the comments that are sent in that you want ethical nurses to answer. And that is us here on Nurses Out Loud. Before we start, I really want to encourage you guys to like and review the platform that you're listening to us on now, to share our stories, and to really just engage in conversation with one another. Allow these podcasts to be catalyst for conversation. You know, we're not doing this here to be in our own echo chamber. Lord knows many of us have wanted to walk away and quote unquote go back to our normal lives, but we are called to a higher purpose. And Sarah certainly is that. So thank you so much for being here, Sarah.
Thank you for having me.
Yes. You know, I'd like to go back to, let's say, March of 2020, when they were talking about the lockdowns and shutting down, essentially the country for 2 weeks to quote unquote slow the spread. Were you aware at that time that this may be nefarious in nature?
You know, at first, I think like most people, I was a bit worried. I had seen on the news and mainstream media all the stuff going on in Italy, and people standing on their balconies, no one can go anywhere, all of these body bags. And I thought, oh my gosh, if this is coming to America, we've got to really hunker down. I'm a single mom with 4 kids, all in elementary, junior high, and high school at the time. And I called my ex-husband and said, schools are closing down for 2 weeks, and I'm in the urgent care, so I'm not letting the kids go back and forth. I assumed that at some point I would catch it, and I assumed at some point I would have to deal with that. And so I didn't want to expose anybody else. I mean, my kids, of course, I had to take care of. I mean, I remember coming home from urgent care and changing in the garage, throwing off my clothes, making sure that, nothing that I had on while I was at the urgent care was touching me coming into the house, jumping in the shower real quick. It was almost like hazardous waste was the clothes you were wearing. And we did that for a couple of weeks, almost fearful. But when we shut down, our urgent care was going from, 110 patients a day to 2 or 3. Wow. I mean, we were dead. We were sending people home. We were laying people off. It was, I thought, okay, if this is so bad, how come nobody is coming in? I mean, nobody. In fact, people that really needed to come into the urgent care who were super sick, not with COVID, but other things, just nobody would come in. Mm-hmm. The hospitals were dead. I would talk to hospital employees and they're like, it's a ghost town. Mm-hmm. I said, why are they flattening? There's nothing going on. So I quickly started to realize that this flattening the curve, there was no curve to flatten at that point. And I started, I started really doing some research, realizing that there were a bunch of physicians in other countries who were being silenced. And it took me a couple of weeks to realize that this was not what they claimed it was.
Okay.
But yeah.
Yeah, no, I hear you on that. I actually did a show on this recently about once they came up with the experimental COVID swab was when they were able to jack up the numbers.
Yeah.
And then when they jacked up the numbers, then people were coming into the hospital and they were put on the experimental remdesivir and all the isolation protocols, being trapped in a room by themselves, the advocate removed, right? Like, and let's not forget that at this time as well, the whole country shut down non-essential surgeries.
Right. Right.
And that was a big deal as well. So, you know, for our listeners, not when you hear non-essential surgeries, you think, well, they're not essential. They should be shut down. Well, until you understand what non-essential means, right? That really is everything. Colonoscopies, cancer treatments, cancer diagnoses, cardiac caths, right? For a blockage. Unless something was imminently killing you, like an active heart attack or an active stroke, everything else was non-essential.
Right.
And we know that working in the hospital, our surgeries are what keeps us going. That is the big moneymaker in the hospitals. So the fact that they were able to convince the entire country, our entire medical system, to shut down their biggest moneymaker, and how they didn't go out of business was just wild. I mean, we know how they did it because of the CARES, right? And we could get into that, but okay. Yes. So you're like, what's going on?
Yeah.
When did you start to find out that okay, so what's going on? Now you're getting patients maybe coming in for the test, right? Because they were encouraging the test. Let's talk about that.
Yeah. Well, at first, we were only allowed to test patients who met the criteria. So they had to be coming from one of the countries that was at high risk. They had to have certain symptoms. And so we were very limited in who we could test. I'm sure many of those patients coming in, well, actually, I think some of my patients who were very sick in November, December of 2023, who I threw everything at them and could not get them better, tons of steroids, and they eventually did get better. I actually think that they had COVID back then, but that's another story. Yeah.
No, hands down. I completely agree with you. And many of us in the medical field, if we took off our blinders and looked at it critically and analytically, we all saw huge increase in viral illnesses, right? Yes. And people were getting discharged with an antibiotic to prevent secondary infection. Absolutely. Depending on how they were doing clinically. They were getting albuterol, they were getting steroids like you talked about, and they were going home and they were fine. And so that test, yeah, I'd like to touch on that too for a minute, because that test initially took days to come back.
Sometimes weeks
To come back. And so, that again was, another, I mean, they were just preparing us. All the while we were healthcare heroes.
Right.
And we were getting free food and we were deemed like, heroes. And for many people in healthcare, they, really haven't got the credit that, they deserved for many decades. So they were relishing in that. Absolutely relishing in that. Okay, so now we are there with the test. When and how were you treating these people? Were they allowing you in the urgent care to continue treating as you would have, say, in December 2019?
Treating them with medications. Yeah, I mean, I didn't know about ivermectin or hydroxychloroquine at the time, but sure, I would put them on a slew of steroids. I mean, we were giving breathing treatments in the urgent care. That's something that changed quite drastically. So, someone came in with shortness of breath and their oxygen saturation was, 92, 93. We would give them a breathing treatment in the urgent care, and then maybe a shot of a steroid, and then away prescription for more steroids, an antibiotic, some sort of, over the counter stuff, supplements, vitamins. That was kind of the protocol that we utilized. And then all of a sudden, no more breathing treatments were allowed in the urgent care, and which is horrible because we've got chronic asthmatics that are coming in, and we know it's an asthma attack. It's not anything else other than an asthma attack. And we would have to deny them breathing treatments in the urgent care. I had a patient, I said, I'm going to have you sit outside and I'm going to give you a breathing treatment outside because you need it that bad. And so I would have them, sit outside so that no one in the urgent care, none of my, higher ups could get mad at me. And I said, I got a guy who can't breathe and he needs a breathing treatment. So if you can't do it in the room, I'm going to put him outside and we're going to get him a breathing treatment outside. So the common sense of treating patients, I mean, all of a sudden it was like everybody coming to the urgent care, you had to assume was COVID positive. And that wasn't the case. And so we ignored so many medical emergencies because everything, COVID took over everything. And so I had a guy come in, shortness of breath, especially going upstairs and oh, he's COVID. I said, no, he's got a PE, and sure enough, sent him to the ER. I said, this is not COVID. You don't have COVID. You got a PE. And he did. And he was in the ICU for quite a while. And it was like, so quickly you jump to COVID that you miss something that will kill them.
Yep.
And so you had to, everyone just put these blinders on to all of medicine they've been taught and symptoms to look out for various diseases. And it was just everything COVID.
Yeah. And so for listeners, PE is a blood clot in your lung.
Yeah.
And
pulmonary
that's,
embolism.
And when that happens, it, you manifest with shortness of breath. I remember once where they had to call in a consult with the cardiologist, and the cardiologist looked through the door and saw the jugular vein distended, which is a sign of congestive heart failure. And that cardiologist came out and ripped that doctor at the station and said, are you kidding me? Not everything is COVID. This person has congestive heart failure. And that too manifests itself as shortness of breath as well. And so that's a very good point to make, that there were a lot of medical emergencies that were going unnoticed because once somebody was COVID positive, they were just pigeonholed into the hospital protocol. So yeah.
Correct. Yeah. Yeah. As soon as you got that COVID positive diagnosis, well, we know now that it was money. But once you get that positive COVID diagnosis, you could be in there for something completely different. And they put you down that COVID protocol. And the likelihood of you coming out of that hospital is now almost none.
Right.
So you never wanted that to be on your chart if you're being admitted to the hospital. God forbid you ever have to go.
Yeah. And when they took away the standard of care for, the various signs and symptoms of a respiratory illness, how did you feel about that at the time? Were you like, oh, okay, I guess steroids do affect this pathology? How did you feel?
Yeah, well, shortness of breath and inflammation always would turn to steroids if it's needed. There was a point where I saw this big lecture, and I used to work at Cottage Hospital, Santa Barbara Cottage Hospital, prior to my urgent care days. And I remember listening to this speaker, and it was in front of a Cottage Hospital group of employees. And they said steroids kill. So it was steroids equal death for COVID patients. And I thought, oh my gosh. At first I went, have I written the wrong stuff for my COVID patients? I'm writing things that could kill them. And that was the fear. And that was the talk of the town was, if someone has COVID, you actually don't give steroids.
Right.
And that's quite the opposite. In fact, they need such high doses of steroids that it's crazy how high some of these patients required that I prescribed for them. I would never normally have thought they could go that high. And that's what they needed to get out of the cytokine storm that this virus created in their body. And so for a while it was steroids equal death. And I remember in my head just going, okay, no steroids, no steroids. These people can't breathe. I have to do steroids.
Right. What else are we going to do?
No. Yeah. And they die if they don't get them. So it was, but it was everything that they told us was the opposite. And I feel like that's just basically what's going on now in this world is you almost just take the opposite of what you're reading and what you're seeing on mainstream media. You have to flip it around. We're in this upside down world. And so steroids save lives. They don't kill, they save lives. And so it's, everything so you had to kind of treat, and no two people are the same. The hospital protocols, everyone gets grouped into one thing. 6 milligrams dexamethasone, I believe, is what they were giving. That's nothing. That's nothing. It's like a sprinkle on a fire. That's not going to get somebody out of a cytokine storm. And many of these patients had multiple underlying medical problems, the really sick ones, where you had to give them even more than what you would give a healthy individual to try to turn this around. So, the hospital protocols you're talking about, the remdesivir and all that stuff, it's deadly. Yeah. It's deadly.
Absolutely. And so when did you realize about remdesivir? At what point?
I actually started really following a bunch of different doctors, and Dr. Brian Ardis, he's amazing. And I remember listening to, I went to a Reawaken America tour, and I believe it was late 2021. I knew about remdesivir, but I listened to him talk prior to that, and then met some of the frontline doctors there, and really started to put it together that this was all a money incentive. Patients could not get hydroxychloroquine. I mean, I couldn't, as a provider, prescribe it because I was in a medical system that they could see what I was prescribing, so it would link to me. So I couldn't write for hydroxychloroquine. The things that actually helped patients, we weren't allowed to utilize. And the things that harmed patients is what the hospital was doing. Telling people to stay inside and not get any vitamin D, don't exercise, eat a bunch of crap, watch the news tick, you could just see all the deaths going and going and going. And so just driving this fear, we haven't even gotten into the masks yet, but it's just, yeah. So it's crazy. So we just, it was very, I wanted to believe that we were doing the right thing. Because I never thought that medicine was as corrupt as it is. So I believed, my beliefs have changed 180 degrees from prior to COVID to now. But you wanted to believe that they were giving you the right information, and it was quite the opposite.
Right. It was mass propaganda, fear-based campaign.
Yeah.
Was what it was. And like you said about the mask, I mean, the masks were the thorn in my side. I just couldn't with them. I immediately, for me, I was like, there is no way that I am covering up my face and my breathing to oxygenate properly for this. There's no way, especially when it was like you could just put anything on your face and then reuse them because we don't have it. I mean, the whole thing was just absolute insanity what the medical community went along with and fell in lockstep with from what I can tell. And you tell me, was there a written policy that said you cannot prescribe ivermectin? Was it written?
No, I mean, it was just a known policy. And, it's funny because when I learned about ivermectin, I didn't really know what it was. I refused the vaccine and then ended up getting COVID, and a physician wrote ivermectin for me. I'd asked for hydroxychloroquine and they wrote for ivermectin. I didn't know what it was. I'd never really heard of it. We don't really have those kinds of diseases, although we do have, parasites, but we don't treat them here. Right. But we it wasn't a drug that I was familiar with. And so when I took it, within hours, I felt better.
Yeah.
So I was able to go back to the urgent care, and my COVID positive patients, I started writing ivermectin for them because I knew that if I wrote hydroxychloroquine, I would be flagged, but nobody had said no on the ivermectin.
Mm-hmm.
And it was before insurance companies caught on. And so I could write a prescription of ivermectin to a CVS or a Walgreens or Costco, and they would fill it. I would often get a call from the pharmacist. Are you sure you want 20 tablets a day? Yes, I'm sure.
Right.
I'm sure. Yeah, because they're 3 milligram tablets commercially.
Exactly. Yes, commercially. Right.
Right.
Yeah. I remember I learned about ivermectin in October of 2020 when my ER physician told me about it. He actually had Dr. Peter McCullough come and testify to the Pharmacy and Therapeutics Committee for hydroxychloroquine. At the time, ivermectin was not, wildly known at that time,
Sure.
but he gave me a doctor who was prescribing. And so immediately I was like, well, I'm just going to get this, and just in case. And I held on to it for well over a year. But all I did was research. I pulled up Micromedics at the hospital and I researched ivermectin. And I saw that it had a remarkable safety profile. There was no black box warning on it or anything. And it was one of those things for me as a nurse that it was like, okay, well, it's not going to harm the patient. I'm not sure if it works, but it's not going to harm them. Well, I started giving, whenever anybody would call me, or, staff was coming down sick, I would say, hey, there's this doctor that's treating. If you want, here's the number. And then I started developing a text relationship with the doctor. To this day, I've never met him. He actually retired, but he was like balls to the wall. I mean, he was prescribing it left and right. And then those people were telling me of their remarkable stories. And so I knew at that time, like, something is wrong here. Well, guys, we have to take a short break, but I want to let you know that this is going to be a 2-part show. Sarah is going to have a couple of her patients come on and tell their stories, because I think it's very important that we hear what people's experiences were. And I know for some of you, they're saying, oh, well, it's over and it's done with, and we don't need to keep talking about it. And for me, I like to sprinkle in these stories of courage and also too real life experiences, so that it really resonates with you guys, and it gives you an opportunity to keep this at the forefront of your mind, that you can share with others that may not be awakened to the truth, and something might click in them, so that the next time something like this happens, because it will, I mean, certainly it will. I'm actually sitting back waiting for another George Floyd kind of moment, because we're getting ready for elections, coming to try to create the divide. But there are more of us than there are them. We just need to empower others to be courageous. And on the second half, when we come back from break, you're going to hear a few stories that Sarah's going to share of her courage and bravery, and the extraordinary lengths that this single mom of 4 children went to try to save the people in her area, and I think throughout the country. But guys, we are kept going here by our show sponsors, our family of sponsors, really. Here on America Out Loud, we're not just promoting people just for the sake of getting advertisers. Even if you go to our website at americaoutloud.news, you're not going to see a whole bunch of pop-up ads. That's just not how we roll here on this network. We roll the way we do by sharing things that work. And so make sure to check out americaoutloud.shop and you can get our exclusive discount for America Out Loud Talk Radio listeners for the products that you feel compelled to use or to try. And we'll be right back after the break. Welcome back. Thank you for joining us here on Nurses Out Loud. I'm your host, Nurse Jody O'Malley, and with me I have Sarah, who is a PA out of California. You know, the show always goes so quickly, Sarah. I tell all of my guests that like an hour is nothing. So I really want to spend this time just telling you, like, you know, have the floor. Tell us a couple of stories of what you did.
Okay. Yeah, so we kind of wrapped around to 2021, and I as soon as the vaccines rolled out, it's when our clinic picked up. And it picked up because people were coming in with a variety of very odd symptoms, totally things we had never seen before, things patients had never experienced before. And my first question always, and nobody's first question other than mine, was, have you recently been vaccinated? Mm-hmm. And so I knew very quickly that the vaccine was causing all of these horrific symptoms in my patients in the urgent care. COVID picked back up very quickly after the vaccines rolled out. I started prescribing Ivermectin. I got called in by my supervising physician, and I wish I could post a picture of her because it's kind of the epitome of what the left and the LGBTQ movement and all of that, you know, it was classic of who was calling me out at that very moment. And they asked me what I was doing with the Ivermectin, and I said, well, I'm treating COVID patients, and I have a duty to do no harm, and I'm not going to tell them that they have to wait till they can't breathe to actually go to the hospital. And she said, well, it's not FDA approved. And I said, no, it is. And it has been for a very long time. We're using it off label, like we use it for use a variety of medications off label. I said, but that vaccine that you keep trying to push me to take, that's not FDA approved. And we got into a tiff, and I got up and I actually told myself, I will never work here again. I won't be part of this. I walked out. I had no idea what I was going to do, but I thought, if I have to work in medicine, which I realized quickly was so corrupt, I will never take that vaccine. So where in the heck in California am I ever going to be able to work? And thought about moving, and I have a license in multiple states. And so I was thinking maybe I'd just go to a freedom-loving state, Arizona being one of them. And I fell into the hands of a physician who I had worked with a little bit in the past. And he said, go ahead and do your thing. Go treat COVID patients. And so I quickly started, I treated my first COVID patient, was actually a COVID prep kit. So I always recommend people have a kit of medication to have on hand: Ivermectin, hydroxychloroquine, budesonide, prednisone, azithromycin, and a nebulizer, oxygen, pulse oximeter, and then a slew of supplements. So I started prepping people, and word got around town, and before I knew it, I was getting calls and texts, about 100 a day, from people all over the country needing help. And it was during the Delta wave, so people were getting pretty sick and requiring home oxygen. And my patients were adamant they would not go to the hospital, and I was adamant that if they did, they would die too. So I was on board with that. We had the monoclonal antibodies. There were a couple local hospitals that would administer them. I had to get approval from the infectious disease doctor. My patients had to be in the ER 5 a.m. They had to have a positive PCR test prior, and we all know about those. Yeah. So if they didn't, they would have to take a PCR test when they got to the ER. So some of my elderly patients were waiting 6, 7, 8 hours in the ER to get their 30-minute round of monoclonal antibodies. And it was horrific. And some of my patients were denied them because they were unvaccinated. They would be turned away. Mm-hmm. And so I fought the public health department, my local public health department. And I said, look, you aren't stepping up to what we need. You guys have all these monoclonal antibodies. We don't have the manpower to get them to the patients that need them the most. let me take them off your hands and I will administer the monoclonal antibodies to my COVID patients. And they, some back and forth and got approval. And so I did. So I would take 40 or 50 at a time. And I would make house calls to patients all over, up and down the Central Coast, driving, 2-3 hours one way to get the monoclonal antibodies in my patients as quickly as I could. So I've met some pretty amazing people, people living in trailers to famous people. I was all over the place. Everybody needed it. And so that was, I was able to, I probably gave them to, 300, 400 patients.
Wow.
And then of course, Omicron came and they said, well, there was a change in leadership. We know that in government. And all of a sudden the monoclonal antibodies were going to be pulled because they said it didn't work for the Omicron. And I said, I don't know what my patients have. I don't know what strain, but 100% of them get better with the monoclonal antibodies. So why are you pulling it? Well, they did. So then it was back to ivermectin, hydroxychloroquine, antibiotic, and oxygen. And I started getting calls from patients, family members whose loved one was in the hospital, and they were sick and they didn't want to be there. And they were, almost, most of my patients, I have one, I think, that got some remdesivir, not all of it, but they were refusing the remdesivir, but hospitals didn't care that they were refusing it. The hospitals were still adamant to give it. And so even if you said, no, I don't want monoclonal antibodies, they were, I'm sorry, no, I don't want remdesivir, they were still giving it. Yeah. So I started working with an oxygen supply company, and they would say, we want our loved ones out of there. We want to use the protocols that you offer. And so we would get ready and prep that. And I would call the oxygen supply company. They would deliver an oxygen tank at the ER or the hospital so that during transport, that patient would have oxygen. I would tell family members, you need to call the hospital, let them know you're going to be getting your loved one out against medical advice so that they are ready to take them out. We get them out, we put them on the oxygen, I'll meet you at your house, and away we go. So I did that multiple times. I had one patient who we called the hospital, said they're going to come out against medical advice. The hospitalist called me and said, what the heck do you think you're doing? And I said, well, look, this patient has been married for 55 years, has never been away from his wife. You're telling his wife that he may come home in a week, he may come home in a month, or he may never come home. She can't visit him. He doesn't want your protocols. He wants to try other things that are different, and you won't let him. And so he would rather die at home if he's going to die than die in the hands of the hospital. And so we prepped the family. They went down to pick him up, and the hospital, they said, well, you have to wear a mask to come in. Fine. So they brought a mask, and then they said, actually, you're not allowed to come in and get him unless you're vaccinated. And none of them were vaccinated, but the hospital was refusing to bring him out because he was going against medical advice. And so they had to sit there and wait and call a family member who happened to be vaccinated. I don't know how many hours it took. And by the time that person got to the hospital, they then agreed to wheel him out. So we're talking about hospitals that were holding patients hostage, telling patients that their loved ones are trying to kill them. This happened many times. Telling them that they're going to die if they leave. Telling them that when they wheel them out, if they have a heart attack in front of them, they will not resuscitate them. Mandating patients be deemed DNR, or do not resuscitate, without patient consent, without family members agreeing. The hospitals just took it upon themselves to do whatever they could do, really, to murder these patients. And so whoever I could get out of the hospital, I did. I went one time with the family, so the hospital won't let my mother out. And so I drove there. I went in, spoke to the nurse, and she was, oh, we can't let her out. She needs one more day. I said, she wants out. Now the nurses on the floor are telling this poor, she's in her 80s, you're going to die. You need one more day here. You're going to die if you go home. So now this poor woman is not sure who to believe.
Right.
She's fearful. Her daughter has to get back on the phone with her and say, Mom, we're here. It's okay. You're going to be okay. We're going to bring you home. You're going to be okay. And then that, and it was almost comical. They bring her down. And of course, this nurse is wearing a spacesuit, basically. I mean, this woman's now had COVID for a couple of weeks. She's not infectious.
Right.
It's just the inflammatory component. And in this spacesuit to just continue to drive the fear. It was this fear mongering. And so every single patient that I pulled out of the hospital made it. And some of which were in the ICU. I had one that they told him, you're not going to make it home. This was the one, if you have a heart attack in the wheelchair, we will not resuscitate you. And we're just adamant, and he is alive and well today. He almost feels like going back over there and just saying, by the way, I'm the one that you said wouldn't make it out. Yeah. And I remember a particular patient. I had asked a patient, well, she had a lot of medical problems. She had COVID for a couple of weeks before she got a hold of me. So her oxygen saturation was already pretty low. I got her home oxygen, steroids, but she required IV infusions every week for hydration. And it had been several weeks, if not more than a month, since she had been able to go in and get IV hydration. And so she was severely dehydrated, which was the biggest culprit to what her symptoms currently were at that time. And so her husband called me and I went and assessed her. And I said, we really got to do IV fluids on her. We can't, it's not COVID right now. It's her dehydration, and her veins were shot. So I told her, and I remember looking at her and I said, you're going to make it out of there. We just need a couple liters of fluid. I'm not going, Sarah. I'm not going. I said, I'm sorry, you have to go. You have to, because I can't help you here. And so we had to call an ambulance, and I remember the paramedics coming, and I said, she's going to test positive for COVID, because you can test positive for 3 months. It's not COVID. She just needs fluids. Can you just get her fluids? You guys can start an IV on her in the ambulance, whatever you need to do, but she needs fluids. They get her to the ER. Her husband calls me and said they tested her. She's positive for COVID. They're doing the COVID wrap. And I said, no, we can't. They did. And she got admitted, and he said, no remdesivir. They gave her remdesivir. Granted, she'd been sick for 2 weeks. So remdesivir needs to be started, if you're going to do it, pretty quickly. And so They just needed that checkbox. Positive COVID patient, give the remdesivir, the intubation, all the stuff that needed to be positive for the hospital to make the most money off that patient's death. Mm-hmm. And she was doing a little bit better with her IV fluids. And her husband said, he was on the phone with one of the doctors and said, do you mind if I three-way call somebody? At this point, the hospital, they knew my name. They didn't know who I was, but they knew of me. And they said, is it Sarah? And he said, yes. And they hung up on him. And he called me and said, I don't know what's going on, Sarah, but they're a little bit scared of you. And I said, well, I don't know what's going on either, but you need to figure out something. We got to get her out of there. And so they then called and had like 4 or 5 physicians on this call with him, the ICU intensivist, the cardiologist. I guess she had a little fluid around her heart. And I said, well, that could have been something that is physiological, and that's not her problem. Don't go hunting for problems. We know what the problem is. The pulmonologist, all these people. And so he said, I want you to talk to Sarah about my wife's condition. And they said, we will only talk to Sarah about your wife's condition. And granted, I'm her provider. Mm-hmm. So never in the history, first of all, if someone's going into a hospital with a list of medications that they're on prior to going into the hospital is supposed to continue those medications while in hospital. They're not supposed to, unless of course that medication is what's causing it. And we know that ivermectin wasn't causing her symptoms. It was helping her. So they refused to do all that stuff. And then they refused to talk to me. And they said, if your wife signs a form that allows us to talk to Sarah, we will. Within about an hour, she was intubated. Mm-hmm. And she was improving. And so they then, and the amount of sedatives that they had her on to suppress her respiratory drive. We can't forget about that. The midazolam, the Precedex, the morphine, you give that to anybody who doesn't even have a virus, and they're going to stop breathing. So the amount of drugs that they gave her to suppress her respiratory drive then required intubation, and they killed her. And I have to carry that on my shoulders, because I don't know what her outcome would have been if he hadn't asked, and you can't blame, but had he not said, can you talk to Sarah, maybe they wouldn't have linked her with me. And they wanted to create a problem and then blame me. So that was actually, the medical board hates what I'm doing. And I'm in California. So of course it's worse in here than it would be. You can get ivermectin over the counter in Tennessee. So it's much worse in California. And so, one of the interns, filed a complaint with the medical board against me with her care. Granted, they had her 5 weeks or so in the hospital before they eventually killed her. That complaint got taken down because whoever wrote it was not willing to kind of move forward with the investigation. And I actually really wanted that case. I was like, give me that case. I want to prove, and her husband said, look, I'll testify. Everything you had her on, she was getting better. Yeah. When they stopped those medications, she went downhill. It was once she got in the hands of the hospital. And so and I want to encourage everybody who's listening, you always want to have ivermectin on hand. It's a must. Whatever they're going to do, whatever virus they're going to come out with, whatever fear mongering they're going to do, and we already see it happening now, have an emergency kit on hand and start it as soon as your symptoms start. And typically you'll be able to get through it pretty quickly. So it's important to find somebody to prescribe that for you and make sure you have that, because the last thing you want is to be without when you need it the most.
Yeah, that's right. Oh my gosh, you said so much there where I'm just like, oh gosh, going back to it is unbelievable that it happened. And, the same thing happened with my coworker, and that was what drove me to record what was happening in the hospital and release it. I recorded the pharmacist, saying, I can't give it. I will lose my job if I dispense it for anything other than lice or scabies. And I'm just blown away. And I even asked her, like, have you educated yourself? Months ago, I gave you information on this. Have you looked it up? And she said, no, I haven't had any time. And I'm thinking, wow. And now she's suing me for $500,000 for painting her in a false light and, all of this stuff, but I feel you, Sarah, like this is not a fight for the faint of heart. And God, right. And I don't even know, do you believe in Jesus?
Oh, absolutely.
Okay.
That's the only thing that keeps me going. I've been under investigation for 2.5 years, and they want you to fold. They want you to quit. They want to beat you down to the point that you give up your license. And I see it happening all the time with providers. They're just done. Sarah, I've spent my entire retirement fighting the medical board. I'm done. And that's their goal. And so I lean on Jesus every day because I can't do it without him. So that's been the rock. And really, we are in a spiritual warfare. That is what's happening. This is good and evil battling right now. And we know who wins in the end. We have to be the warriors that fight on the ground.
Oh, amen. Amen. I tell you, I had the discernment, the Holy Spirit gave me the discernment immediately in February, right? In February of 2020. And throughout February to June, I just saw what was going to happen. I felt it in my spirit, and when I say I saw it, it was because everything that was, the closing of the schools. I knew we were going to create a generation of, anxious, depressed, suicidal children, right? How can you not? How can you
Right.
not, if you remove your children away from being children and told if they breathed on somebody, they could potentially kill them? I mean,
Right.
and I could go on and on with that, but that is where I was just so tormented. I literally was tormented every day, knowing what the possibilities were. And the
Right.
fact that the medical community went through this. And
Right.
now I'm back in the emergency room. I don't advertise that I'm a whistleblower. People do know I have been recognized. They are keeping it quiet because I just wanted to be Nurse Jody and go back to the bedside and do what I love to do. But every single one of them knew that what we were doing was wrong, but they were just manipulated. And I tell people, I look at people as spiritual beings. Okay. I see that we are human and that we're living and breathing. And then one thing that separates us, from crossing over is our last breath or the, stopping of the heart, whatever. But I look at people as the spirits that are leading them.
Yes.
Because that is exactly right when what you're talking about. And I want to give you 30 seconds. Tell our listeners something positive that they can do to combat this fear and use their voice in the way, that you did.
Yeah. Well, the first thing is turn off the news. So, the news is lying to you. Don't live in fear. Fear, Jesus tells us, keep your eyes on me. The world is crazy. Don't focus on the world. Focus on him. Follow him, and he'll get you through it. Be the best, healthiest, most fit person you can be. Eat clean. Make sure you get enough vitamin D. Make sure that you're out in the sun as much as you can. Exercise so that your body is prepared if you get sick, that you have a better chance at fighting it. And be prepared. Be prepared. Have plenty of food. Have plenty of water. Make sure that you've got. I'm a Second Amendment advocate. Make sure that you have protection, and but you cannot live in fear. You cannot live in fear. You have to stay strong, follow your heart. And one thing with the medical community that is so frustrating, because we all know, and they know, that the masks don't work. I'll just say one little blip on that. We're the last profession to give up the mask. So you don't have to wear it in a bank. You don't have to wear it in a grocery store. You don't have to wear it at a gas station. You don't have to wear it wherever. But you go into a doctor's office and they're starting to require them again. We look like idiots for the doctors in the medical profession who understands the size of the virus, the masks that they don't work, and we're the last one wearing it. It goes to show the amount of money and greed that goes behind this drive. But to everybody, keep your eyes on Jesus. Keep your eyes on Jesus.
Matthew 6:33 says, but seek first the kingdom of God and his righteousness, and all these things will be added unto you. And guys, that's where I want to leave you with today. It is, if it wasn't for Jesus and the power of the Holy Spirit to work through us, when we allow him to, the Holy Spirit's going to do what he's going to do, because God says that he works all things according to his purpose, right? And so we're going to be used whether or not we know it, but submitting to God's will and not our own is a completely different life. And I encourage that all the time. Listen to my previous shows here, because I do talk about courageous people in the Bible. And I just hope that you are, can relate to it. This isn't just a bunch of fairy tale stories. These are things that happen. The Bible has been trying to be disproven for, centuries. And it's not going to happen because God's word is true. And make sure you join us next week when we hear these stories of the patients that were in the hospital that Sarah helped to live. They're still living and able to tell their story because of the courage that Sarah had. And Sarah, tell people how to find you real quick.
Yeah, my website is holisticsarahpa.com. And then you can find me on Instagram, Holistic Sarah PA, as well as Facebook, Holistic Sarah PA, and TikTok, same thing, Holistic Sarah PA.
Perfect.
And if you need, yeah, and I can still prescribe to all 50 states Ivermectin for COVID. So if patients need COVID kits, call my office. And they can get you on my calendar. So that's something that we're still allowed to do. It doesn't matter where you're licensed. If it's for COVID, you can prescribe COVID kits or treat COVID patients in all 50 states still.
Awesome. Awesome. All right, guys. Well, this concludes this amazing interview. And, until next time, be safe, be well, and God bless.